We talked about how to get healthcare clients as an interior designer, whether you're on your own or working for a firm, have a degree or not. Part two, we're talking about the technical things that you need to keep in mind in healthcare interior design that are different from other standard types of interior design like commercial or residential. With all interior design, we have to be very focused on the end user experience. So for healthcare interior design, you want to really hone in on who your end users are, who these clients or patients and their families are. With healthcare design, you're not just considering patients, the residents, clients, those end users, but you're actually considering their families. So for nursing homes, for example, the families are going to want to feel comfortable about where their loved one is going to be, right? If it's a pediatric office, the parents have to be considered here. It's not all about the children, but it is also very much about the children. Drug rehabs, I would say very similar. There are very specific things that you have to keep in mind for drug rehab design in terms of the patient, the addict that's going in for recovery, but also their family members are looking to have a certain environment and feeling on behalf of their loved one. You are hired for a healthcare project. You're not hired by your end user. Unlike residential design, where most of the time your client is your end user and maybe their guests, but really them. Here, your clients are going to be more corporate level. They're going to be investors. They're going to be owners. They're going to be operators. And you're going to have to navigate what their personality is, what their corporate understanding of their business is, and what their end user experience really needs to be. And that's where you have to be the professional here. That's where you have to do your research and you have to come in strategically informing them of what needs to happen here, as well as listening to what they feel needs to happen in their space. Then we've got technical things to consider. Healthcare is one of the highest levels of specific compliance needs. So I'm clearly not going to be able to go into everything here for every single type of healthcare design, but certain things that you need to consider are fire ratings. So your materials are going to have to be durable. A lot of your design is going to need to be focused on very, very specific functionality needs. So there are different teams often in healthcare design that will be working together or working with the patient, and you have to design with everybody in mind. You know, your nurses need certain kind of access. Your patients need certain kind of pathways and easy access to certain things that they need, whether it's in the bathroom or a bed or a patient room, a doctor. Just sitting with a friend who is also an interior designer, and she was speaking to somebody on her team about, I believe, a nursing home they were working on, and somebody on the team had put a light fixture above the bed, and it was a light fixture that protruded a certain amount off the wall. Now you're talking about an established firm with multiple locations working on dozens and dozens of projects. This is not their first rodeo in healthcare. And yet their team was still making a huge compliance mistake, and she had to point it out and have them fix it. And she had to point out that, well, that patient can hit their head on that. You can't have something at that height protruding. So those are certain basics that you need to know about healthcare and design and compliance. There's many, many more. I'll give you another example. In a nursing home, you have hall light fixtures. There are specific rules in nursing homes of how far out from the wall and what height these sconces can be for compliance reasons. Another couple of things to consider, let's talk drug rehab healthcare. So for drug rehab healthcare, often, or any kind of rehab healthcare, often you have to design with suicide risk in mind. And that is a whole nother ballgame. I mean, there are certain things that you can't spec. You can't spec anything that something can be tied to. It's very daunting. It's very dark, but it's also, you have so much power in your hands. And that's something I want to point out also. This is not necessarily compliance or spec, but healthcare is such a special thing to be involved in, especially when it comes to rehab, because you are creating the environment where somebody gets to restart their life, where somebody gets a second chance, where somebody's life was quite literally at risk, and your choices, your actions, your skills can be a make it or break it in how they feel when they walk into a space. Of course, the programs and the doctors and all of that is a huge part of it, but so is the design, so is their environment. A technical thing with drug rehabs that I learned the hard way, you have to be really mindful of patterns. And this is not just for drug rehabs. Patterns, dementia wards, you have to worry about that. Like anything that's too dizzying can stress them out. But drug rehab for sure, you don't want any patterns that are too dizzying, going to give them a headache, trigger something. But more than that, you have to be really careful about shapes that they don't trigger any kind of memory. For example, I put in beautiful, what I thought were safe, abstract paintings in a hall of a drug rehab. Turns out I had to go in there and hand paint over them because some of the abstract lines looked like needles and syringes. Those are some of the compliance things. If you are going to get a job in a healthcare project, make sure that you do a deep dive into the compliance considerations that you need for that type of healthcare work and for that type of healthcare space in your state or in that state. If you have any other specific questions on healthcare design or any other niche design that you want me to do some videos on, make sure to let me know in the comments.